Hello and good day. I'm Dr. G.R. Vijay Kumar, Director of Neurosurgery and Spine at Fortis Hospital, Anandapur, Kolkata. Today I'm going to talk about a very common neurosurgical condition that we encounter very frequently called a subdural hematoma. What is a subdural hematoma? It is a blood clot inside the skull, but not within the brain. It is in the space between the brain and the covering of the brain called the dura. Now, depending on how quickly this develops, we class this as acute when it has occurred very rapidly, subacute when it has been there for a few days, and chronic when it has been there probably for a few weeks. Now, who are the people who get this kind of a hematoma? Anybody can get a subdural hematoma. Young people usually get it with severe head injuries, and then in that case, they are acute subdural hematomas. Older people can often get it with small or trivial injuries, and then they can be either subacute or chronic in their manifestation. How do they present? Usually with headache, sometimes with sort of weakness on the opposite side of the body, lack of balance. Very occasionally, they can present with a convulsion or what we call an epileptic seizure. If you have any of these symptoms, you need to consult your doctor. The diagnosis is very easily made by performing a CT scan of the brain, and then your doctor can guide you for the appropriate treatment. If the hematoma is small and it is not causing much pressure on the brain, it can be managed by observation and with medications. But if the hematoma is large and it is causing pressure on the brain and causing symptoms, then unfortunately it needs surgical treatment. The surgery is a variety of techniques that we use. So you can do small holes, which are called burr holes, and then you can wash out the clot. But more often, we do a small window in the skull called a craniotomy, and then we'll wash out the clot through that. By and large, the results of this kind of surgery are excellent, and we expect the vast majority of patients to come back to a completely normal life following this kind of surgery or treatment. Thank you.